Hello, my name is Rebecca Chicky, and I am the Senior Director of Behavioral Health for the American Hospital Association. And it's my honor to be joined today by Dr. Zaira Khalid, who is the Senior Staff Geriatric Psychiatrist at Henry Ford Behavioral Health Hospital, which is located in West Bloomfield, Michigan. Today, our discussion is entitled Improving Behavioral Health for Older Adults, Lessons from Henry Ford Health. Thank you so much for being here with us today. What I'd like the listeners to learn and hear first from you is what is the situation? What's the prevalence of psychiatric or substance use disorders in individuals who are 65 and older? And what are the perhaps unique circumstances that older adults may experience that may drive conditions such as depression or anxiety?
Firstly, Rebecca, thank you for having me. Thank you for shedding light on this very, very important topic that I think doesn't get enough attention and should be getting much, much more attention. And just because of the need that there is. So, in terms of mental health and substance use disorder treatment, it is definitely underreported and underdiagnosed in our elderly patients. Having said that, the numbers are still very high. So patients who we look at that may be, let's say, admitted to the hospital with medical concerns and have medical comorbidities, their prevalence of having psychiatric disorders is going to be anywhere between 40 to 50%. That's very, very high. Substance use disorders in the elderly, I believe the last time I saw a good study was in 2022, 11 in 60 adults, older adults, had a substance use problem. And that's only those that are being diagnosed. I can tell you from personal experience, it's a lot higher than that. We just don't recognize it. So a lot of our elderly are struggling, not getting the help they need, not seeking the help they need due to various factors. But what leads them to where they are with their mental health and where they are with their psychiatric health are that they're a unique population. They go through stressors that majority of the other population doesn't. They're at a stage in life where they are losing their loved ones around them. They're losing their friends that they've had their entire life. They're retiring from their jobs, which is what gave them meaning in their life. Their kids are moved out of the home, busy with their lives. That was a huge part of their life that gave them meaning, parenting, raising their kids. They're now sometimes, most of the time, having to give up their homes and they're moving into assisted livings or nursing homes. And it's a completely different environment, completely different level of independence. They're not driving anymore. So all of those things put together, I think, would be stressful for any one of us. And once you add on medical problems like not being able to walk as well, having diabetes, possibly a stroke, it just leads to sort of a concoction of items that's going to lead to poor outcomes if not intervened.
Absolutely. I saw my own mother go through this, and now my husband's parents have done exactly what you've described. They've moved into an assisted living facility. My father-in-law is now 94 and wheelchair
Wow.
bound,
Yeah.
and my mother-in-law is younger and still active, and so there's also that sort of strain.
Mhm.
Luckily, they do still have friends that are their age that are
Yeah,
in that same living facility, so that's helping offset.
that's
But
great.
but it doesn't
Mhm.
eliminate all the other challenges that you
Yeah.
described.
Yeah, social isolation is very real and very dangerous.
Absolutely. So tell me, in the design and the development of the new Henry Ford Behavioral Health Hospital, what did you do to better meet and accommodate the needs of the older adult population, both perhaps from a physical design, but additionally from a treatment design? What's your approach?
Yeah. Well, we wanted to make sure we had a designated spot and a separate unit, a physically separate unit that was dedicated to older adults. So we could focus on the design being different and accommodate all their needs. So simple things like having handrails on the walls in the hallways, so that they're able to hold them and walk, which is not something that you commonly see in an inpatient psychiatric hospital. Having a courtyard outside that allows for more relaxation. So, it's surrounded by trees. There's benches, sunlight, which is very different than some of the other courtyards we may have for a younger population where we want them to be a little bit more active. So they've got basketball hoops and such. Things like having call lights. So a psychiatric hospital, generally, we don't have call lights because it can be a safety measure. We don't want to have a lot of cords and strings, but for our geriatric unit, we wanted to make sure we have those in case there's a fall while they're using the restroom. We have more bathrooms on this unit that are ADA accessible and have shower chairs. So they're able to sit and take a shower with handheld showers so they don't have to stand for too long. So those would be kind of some of the major design elements that we kept into account. And the other was really having staff that has been trained and experienced in dealing with this population and knows what to look for. And it's not just about the treatment they get here, but also what we set them up with once they leave here, and staff that has the knowledge of that. So how do we set them up with resources that is going to keep them involved in the community, keep them active? And how do we give them tools that they can learn here and continue to utilize outside of here? So that's a social worker that is well versed in some of the resources we have here, the PACE program, which is designed for the elderly, day programs for the elderly. We've got activity therapy that is used to doing activities that may be designed for those with less cognitive reserve. And sometimes it may just be as simple as musical instruments, because that's the capacity, the cognitive capacity we have. We had exercise equipment that some of the activity therapists can bring onto the unit and teach them how to do exercises. Just, sitting in the day room is something that they can translate into their own living rooms when they get discharged. So we really wanted to make sure that the staff is able to identify those needs in these patients and help them teach some of the skills that they can also translate outside of here, because this is just a week of their life or 2 weeks of their life.
I had a thought while you were describing all the talents of the staff that you've recruited, and wondering, I'm kind of leading the jury here, also staff who care and who look forward to working with individuals who are in perhaps their last decades of life. It's been my experience working in healthcare for over 30 years now that there's often less of a shortage for people to work in the labor and delivery unit. They want to see the new life come forward. They want to work with the
Yes.
babies and the
Yes.
new moms. But geriatric care has had its own challenges. So has that been something too that you've focused in on to find those people with that passion?
100%. So everyone that works on the geriatric unit is staff that has always voiced that they want to work on the geriatric unit and always has in the past. So our social worker has been in geriatrics for a long time. Our activity therapist has been in geriatrics for a long time. So I love working with the older adults. It's all I do. So all of us share that passion. And I think that's why we work so well as a team. I think that's why our patients can see that when they're here and getting the care that they want. So for sure, I think passion has a lot to with it. It's not a population that most people choose to work with or want to work with. Something I've never understood why. I think it's the absolute best population, the sweetest population you could, and the most rewarding population you could work with. But the passion of the team is definitely there.
Wonderful. I think another not to say that what I'm about to say doesn't exist
Sure.
in individuals who are under the age of 65, but often individuals who are 65 or older may have physical illnesses as well. Their diabetes may have gotten to a certain stage, or their congestive heart failure. So how do you integrate physical and behavioral health?
That's a wonderful question. So one of the things that I'm very passionate about is cut down their meds. A huge problem we have in our geriatric population is polypharmacy, meaning they see multiple doctors because they need to, and there's a lot of multiple medications being put in, and sometimes they interact, they cause side effects. Then medications are prescribed to counter those side effects, and this is a population very sensitive to that. So we have a fantastic family medicine team that we work with very, very closely. They're in-house 7 days a week, a wonderful pharmacist who helps us. And we really try to treat the patient as a whole. So for example, let's say someone gets admitted for uncontrolled anxiety and they've also got diabetes. My first approach is not to go ahead and prescribe them something for anxiety. It's to look at their blood sugars, because we know fluctuations in blood sugars cause anxiety, geriatric or not. It's much more prevalent in geriatrics because they're more sensitive to blood sugar fluctuations. So my first thing is, let me work with my family medicine counterpart and let's get these blood sugars under control. And if we're still seeing the anxiety, then yes, we will intervene with something that is safe, doesn't interfere with their diabetes medicines, their heart medicines, and try to treat those. Working with nutrition, who's here, and making sure that these patients have the adequate diet, have the adequate protein levels in order to gain some strength back that they might have lost. So putting all those teams together and really having that multidisciplinary approach to patient care, I think, is what works really well.
Yeah, whole person care. Who knew? The brain is connected to the rest of the body.
The
And
brain
if
leads
it's
the
not,
body.
we have a bigger problem, right? So,
Yeah, it leads the body. It's the leader.
exactly. Do you have a story you'd like to share for the listeners? A success story when you've seen this approach be used?
Yes. Actually, the diabetes medication story, example I shared with you, was a real life patient. So, I mean, these are all sort of lessons learned, and educating families on how important, managing their blood sugars are. We see this day and night. Another very common thing that I see a lot of times is the sleep. A lot of our elderly have trouble sleeping, and that leads to irritability the next day. That may lead to behaviors like agitation in a nursing home, or they're coming in because they might have hurt someone in a nursing home. And when we really kind of think back and look back into it, one of the biggest things is sleep. It's not that they are agitated because they have bipolar disorder or they have something else going on. It's sleep. And having to target that. And once they've gotten a good night's rest for a few nights, they're a completely different person. And I think we can all relate to that. I mean, nobody does well without sleep, but these patients and their brains are much more sensitive to that.
Absolutely. So, I have a couple more questions before we wrap up. The first is, if one of the listeners is thinking about creating such a program as yours in their own organization, whether it's in a freestanding psychiatric hospital like yours, or they're going to try to adapt it inside a general acute care hospital, do you have maybe 2 or 3 things that you think you did as you were planning for this that really provided the successful foundation that you're operating from now?
Yeah. So I think number one is what we touched on earlier, was having staff that is passionate about this population. It is not an easy population. There's a lot of medications. There's a lot of social factors that are involved. I think one of the other key elements is collaborating with your community resources. We can only do so much. They are going back into the community and they're going to need those resources. So knowing what those resources are, knowing how to refer patients to those resources is going to be extremely, extremely important. Those are two of the biggest things I think that leads to success when treating geriatric patients. And then having a collaborating counterpart that is going to be medicine, because these patients have significant comorbidities that you're going to need the help of your family medicine colleagues, or your internal medicine colleagues. I think if you can work together as a team with them, you can really, really help these patients significantly.
Wow, I'm so inspired. If I had the capability to go start one of these programs, I think I would do it right now. But I don't. Thankfully, we have professionals like you and the wonderful team at Henry Ford Health. My last question to you is: do you have words of inspiration or a call to action that you'd like to share with the listeners of this podcast?
Sure. I think call to action for me, the biggest thing would be check in on your older loved ones, please. I think a lot of them are part of a generation that doesn't talk about mental health. They're from a generation that did not necessarily believe in mental health and have the mindset of just keep pushing and it'll get better. Just keep going and it'll get better. And sometimes it doesn't. Check in on them. I think if a lot of also please keep a close eye on them for any substance use. We continue to see a rise in substance use in our elderlies, and it's really leading to a lot of other complications as well. So, I'll give you an example. For example, if a grandmother falls down the stairs, our first instinct is she's old, she tripped, and she fell. We don't ever test her, or very rarely do we test her for alcohol. Was she intoxicated? Is that why she fell? It's not our first thought. So please look at those things, look at their safety in their home, see how if they're involved in the community or if they're spending all their weeks in their apartment. Get them involved volunteering at the library, community center, day programs, whatever it may be. Giving them a purpose, giving them a routine can be so, so beneficial for them.
That's wonderful and exceptional. And thank you so much for your willingness to share your passion, your time, your expertise, and to inspire others on this really important journey.